5 things to remember about Clostridium species. So we will cover 3 different types of Clostridium: Clostridium perfringens type C and Clostridium perfringens type A, as well as Clostridium difficile. Pigs usually get infected by Clostridium through the feces of the sow, so they get infected very early in their life. Additionally, Clostridium difficile is part of the normal flora of the colon of any pig. So to get clinical signs associated with Clostridium difficile, there needs to be an antibiotic treatment. And after that treatment, all of the normal flora of the colon is eliminated. That gives the opportunity for Clostridium difficile to multiply, replicate, and take over in the colon and cause clinical signs. So all of those 3 types of Clostridium create issues in piglets within their first week of life, but the signs they cause are quite different. Clostridium perfringens type C can have very acute, even peracute signs with really high mortality in baby pigs and hemorrhagic diarrhea. So we will see the piglets that have blood stains on their rear end and sometimes necrotic debris in it. But it can also be chronic. So Clostridium type C chronically looks like Clostridium perfringens type A. They are hard to differentiate. The mortality is much lower, and then we just see a brown sticky diarrhea in the baby pigs. Clostridium difficile, also much milder. There is a low mortality associated with it, and yellow pasty type diarrhea in the baby pigs. So the lesions we can see with those different Clostridium, with perfringens type C, we will see a necrosis of the mucosa and the villi atrophy, meaning that you will see that the jejunum and the ileum are really thin-walled. When you open them up, you have all of those necrotic debris inside and that hemorrhagic content. In the more chronic cases of perfringens type C, it looks like perfringens type A, and it's quite frustrating because there are really few lesions to see, either macroscopically or microscopically. For Clostridium difficile, at necropsy, we will see edema of the mesocolon, meaning that in the spiral colon, the different loops will be separated from each other with an enlarged edematous connective tissue. And under the microscope, the typical lesions look like eruptive volcano that actually are suppurative. Pretty typical for Clostridium difficile. So in cases of acute Clostridium perfringens type C infection, the diagnosis is usually done by clinical signs and the lesions because it's really typical. But when we are in the more chronic forms or with Clostridium perfringens type A, we want to use PCR to identify the strains. For Clostridium difficile, we tend to use an ELISA to identify the toxins. So Clostridium can be treated with antibiotic. We will tend to choose antibiotics that concentrate in the intestinal tract, like aminoglycosins. But we can also use antitoxin treatments. Vaccination of the sows is the best way to prevent clinical signs. So we vaccinate the sows 2 to 3 weeks pre-farrowing so that they reach that maximum concentration of antibodies in the colostrum and protect the piglets in their first week of life. Cleaning and disinfection of the farrowing room is really important so that we don't contaminate the following group. But remember that Clostridium can create spores and can be quite resistant. So sometimes it's challenging, and we may want to do 2 cycles of cleaning and disinfection.